Today, I'm going to be talking to you about the drug Lorazepam, also known commercially as Advan. Lorazepam is a short-acting, rapidly cleared
benzodiazepine.
Used commonly as a sedative.
Benzodiazepines
Were first discovered back in 1954 by an Austrian chemist named Dr. Leo Sternbach. It was actually an accident when it was discovered. When Dr. Sternbach put a failed experiment on the shelf for a year, it was kind of like putting a bread on the shelf, but instead of becoming stale, it turned into something super instead. How does the lorazepam work, you might ask? It works by increasing the level of calming chemical gamma-aminobutyric acid, GABA for short, which can help a patient feel calmer, relieve anxiety, or stop seizure fit. Side effects for this drug typically include drowsiness, dizziness, dry mouth, changes in appetite, nausea, and serious side effects ranging from constipation to death. Examples of alternative medications that could be used in place of Advance are various antidepressants and other
benzodiazepines
like Xanax or Valium. There are four kinds of functional groups in the expanded structure for lorazepam, which contains two aromatic rings, two halogens, and a amide, and an alcohol functional group. Within lorazepam, there is only one chirocarbon. Chirocarbons are atoms that attach to four different functional groups. Within the vascular geometry of lorazepam, we can see that there occurs many instances of trigonal planar geometry, many instances of bent geometry containing one single bond, and only a few instances of bond geometry with a double bond and tetrahedral geometry. Here we can see the polar regions of the molecule highlighted by the green ovals. Water molecules are able to bond with the polar regions due to polarity. A donor and an acceptor occurs which facilitated the bond. However, due to the aromatic ring on the outer section of the molecule, lorazepam is actually quite hydrophobic. Hydrophobia is, by technical term, the fear of water. Due to the aromatic ring in the lorazepam structure, the molecule is not very soluble in water, and in a sense is, quote, afraid to bond with water molecule. In order to have pH changes in the molecule, it requires specific acid and base groups such as phenol, phenolate, carboxylic acid, carboxylate anion, amine, and ammonium salt. Unfortunately, the expanded structure for lorazepam does not contain any of these acid and base groups, and therefore pH changes will not have any effect on this drug. Due to the insolubility of lorazepam, the drug will not be dissolvable in water. When taken orally, the drug is broken down in the liver by an enzyme and binds with
benzodiazepine
receptors in the central nervous system. This turns to help stabilize the cellular plasma membranes in the CNS, which relieves anxiety disorders and help with seizure disorders. Thank you for watching. Ask away questions.